Hey everybody, welcome you all to Bio School. This is Gayatri. In today's session, we are going to discuss about blood pressure and its regulation. Before starting today's session, if you have not subscribed my channel yet, then please do subscribe and stay connected. So let's see what is blood pressure and how it is regulated. Blood pressure. What is blood pressure? Blood pressure, it is the pressure exerted by the blood against the wall of artery, is known as blood pressure. See, this is the vessel or the artery wall and through which the bloods are flowing, and you know the blood, it is composed of the blood cells and the plasma. The plasma and the blood cells, they exert the pressure or the force it is applied against the wall of artery, and that is known as the blood pressure. So blood pressure is the force exerted by the blood against the wall of blood vessel. Blood pressure, it depends on two factors. What are those? That are cardiac output and peripheral vascular resistance. So blood pressure, we can write it as blood pressure equal to cardiac output multiplied by peripheral vascular resistance. So first we will see what is cardiac output. I have a video on cardiac output where I have discussed in details about cardiac output, stroke volume, heartbeat, and how the stroke volume it is regulated. You will get the link in the description box of this video down below and the suggested video above. So first we will see what is cardiac output. Cardiac output, it is calculated by multiplying the stroke volume with heart rate. So what is stroke volume? Stroke volume is the volume of blood that is ejected by the ventricles per beat, is known as stroke volume. Heart rate is the number of beats per minute. So we can write it as like this. The stroke volume, it is the volume of blood ejected by the ventricle per beat, and heart rate is the number of beats per minute. So what is the cardiac output? Cardiac output is the volume of blood ejected by the ventricle per minute is known as cardiac output. So cardiac output, it is calculated from the stroke volume and the heart rate. So if there is any change in the stroke volume and heart rate, that will affect the cardiac output, and cardiac output, that value is and the cardiac out and blood pressure, it depends on the cardiac output, right? So now we'll see what are the factors that affects the stroke volume and heart rate. Stroke volume, it is affected by preload. What is preload? Preload is that when the blood it enters into the ventricle, then the ventricular wall that gets stretched. Okay, the stretching is, it is known as the preload, and the stretching, it is caused because of the end diastolic volume. End diastolic volume is the volume of the blood that present in the ventricle before its contraction. It may be preload is caused because of the venous return, or maybe the respiration also responsible for that, and if the heart filling time is more, then more blood will fill inside the ventricle, that will cause the preload. Okay, then the contractibility also affect the stroke volume. Like a sympathetic nervous system, it increase the contractibility, whereas the parasympathetic nervous system, it decrease the contractibility. Similarly, some hormones like thyroid hormones and epinephrine, they also increase the contractibility of the heart. Certain ions like calcium ion, it will if the concentration of calcium ion increases, then contractibility will increase. But if the sodium and potassium ion concentration increases, then contractibility will decrease. Similarly, certain drugs like digital age, dopamine, atropine, they increase the contractility of heart, whereas the calcium channel blockers, they decrease the contractility. Then afterload. What is afterload? It is the amount of resistance that must be overcome in order to eject the blood from the ventricle. It is known as the afterload. So we can say that if the preload it increases, then stroke volume it will increase. If contractility increases, then also the stroke volume it will increase. But if afterload increases, then the stroke volume it will decrease. So afterload, it is caused because of the dysfunction of aortic valves, or it may be by the atherosclerosis. If you want to know in details about the regulation of stroke volume, then I have a video on the cardiac output. You go through that video, you will get detailed explanation of stroke volume there. Then now comes to the regulation of heart rate. Heart rate, it is regulated by the nervous system, of course the sympathetic nervous system. So the sympathetic nervous system, it release the hormone epinephrine. Epinephrine, it increase the heart rate, whereas parasympathetic nervous system, it release the hormone that is the acetylcholine, and acetylcholine's receptor is M2 receptor or muscarinic receptor that decrease the rate of heart rate by depolarizing the membrane. Hormones like T3, T4 hormone and epinephrine, it increase the heart rate. Body temperature, if body temperature increases, then heart rate it increases. If body temperature decreases, then also the heart rate decreases. Age also has a significant effect on heart rate. Like in infants, the heart rate is more. Age also has a significant effect on heart rate, right? In the infants, the heart rate it is about 120 to 140 beats per minute. Then it will come to 70 to 70 beats per minute. Then when we grow older, then again the heart rate it increases. Gender, in case of the female, we will get a higher heart rate in comparison to the males. Certain cations like if increase in the potassium ion and the sodium ions, they will decrease the heart rate, whereas if the calcium ion it increases, it acts as a positive inotropic agent and it increase the heart rate. So the stroke volume and the heart rate, it affects the cardiac output, and the blood pressure that depends on the cardiac output. So the factors that regulate the stroke volume and heart rate, that of course regulate the cardiac output, and the blood pressure it depends on the cardiac output. Okay, so now we'll see the another factor that regulates the blood pressure is peripheral vascular resistance. So what is peripheral vascular resistance? It is the resistance of blood flow that is determined by the diameter of blood vessel. Okay, if the diameter of the blood vessel it is larger, then the blood flow it will be less. Okay, but in turn, if the diameter is smaller, then blood flow it will be more, right? See here the aorta. Aorta, the diameter is smaller as compared to that of artery. So see here, this one is the aorta, then aorta it divided or branched into arteries, then artery into arterioles, then arterioles into capillaries, then capillary further into venules, venules into veins, veins into vena cava. So here we are taking the total cross sectional area. Okay, if we compare the diameter of a aorta and capillary of single capillary, then of course the diameter of aorta is more. But if we are taking the cross sectional area, like that means the total diameter of the capillaries, not the individual, total diameter of the capillary, then of course the diameter of capillary it will be more than the diameter of aorta. As I told you before, if the diameter is more, then the blood flow it will be less. Okay, so see here in the aorta the diameter is less, so the velocity of blood flow is more in aorta. But when we move towards the capillary region, see over here the velocity of blood flow it is less. Why? Because the diameter of or the cross sectional diameter of capillary it is more. That's why the velocity of blood flow is less. If the velocity of blood flow is less, then the blood pressure or the BP in capillary region it decreases. Blood flow decreases. Also the BP decreases. In the capillary region the blood flow is less, as that of the blood pressure will also be low. As the blood flow is low in capillary, that is good for the capillary exchange. It will get more time for the exchange of nutrients and the oxygen from blood to the body tissue, right? Okay, smaller the lumen, greater the resistance, ultimately blood pressure rises. If the lumen is the smaller, then blood pressure will be more. So where the blood pressure will be more? Blood pressure will be more in the aorta region and less it will be in the capillary region. Okay, so these two factors, peripheral vascular resistance and cardiac output, that affects the blood pressure. So the normal blood pressure is 120 by 80 millimeter mercury. And then what is the 120? 120 it is replace the systolic blood pressure. Then what is the systolic blood pressure? Systolic blood pressure it is the maximum pressure during the contraction of ventricle. Okay, it is the maximum pressure during the contraction of ventricle is known as the systolic blood pressure, and the denominator that represents the 80, it is known as the diastolic blood pressure. Diastolic blood pressure is the maximum blood pressure when ventricle it is present in the relaxed state. So this is the normal range of blood pressure, but let's say if the range it is more than this one, it consider it may be the 140/90, then that is caused the hypertension. Hypertension it is caused because of the diet. If you are consuming more unsaturated food and the oily diets, that cause the hypertension. Similarly, with increase in the age, blood pressure rate is also get increased. It may be because of the different heart problems. Okay, so if the range it is lower than the normal range, then that cause the hypotension. Hypotension it is caused because of the loss of the blood, maybe because of heart problems, pregnancy, lack of nutrition in the diet. Okay, all these factors that leads to the hypotension. So how can we calculate the pulse pressure? Pulse pressure it is the difference between the systolic blood pressure and diastolic blood pressure. So what is the normal range of pulse pressure? Normal range of pulse pressure it will be 120, it is the systolic pressure, minus 80. 80 is the diastolic pressure. So what will be the pulse pressure? It will be 40 mm per Hg. Okay, it is the 40 millimeter of mercury. Okay. So now we'll see what are the factors that affecting the blood pressure. First, it is the age. As the age increases, blood pressure it increases. As we are growing older, at that time the blood pressure or the wall it will be more rigid. Elasticity it will be lost. That's why the systolic pressure it will be more, which cause the increase in blood pressure. Body size and obesity. If you compare the two individuals, they of same age, then the individual which one is the taller and obesity, or that individual have more blood pressure as compared to the other. Then the gender. Gender also has a significant effect on blood pressure. As after the puberty, male of course have the higher blood pressure than females, but after menopause condition, the female have higher blood pressure than males. Emotion and the stress. During the emotion and the stress, the sympathetic nervous system it will get activated. When the sympathetic nervous system it get activated, it cause the vasoconstriction, means the blood vessel or the diameter it is constricted. If the diameter of the blood vessel it is the constricted, then what will happen? Then it will cause the rise in blood pressure. Diet also control the blood pressure. People who are taking the diet that is rich in the salt, unsaturated fatty acid, they have the higher blood pressure. Exercise, if you are doing the regular exercise, then that will lower the blood pressure. If you are doing the regular exercise, then that will decrease the blood pressure and it will help in keeping the blood pressure at normal level. Diurnal variation. Usually the person have low blood pressure only in the morning, but that is going to be peak in the evening time. Some chemicals like epinephrine, antidiuretic hormones, angiotensin 2, they cause the vasoconstriction. Vasoconstriction means they elevate the blood pressure. On the other hand, histamines, kinins, they cause the dilation of blood vessel and decrease the blood pressure. So this is all about the blood pressure and what are the factors that regulate or affect the blood pressure. Now we will see how can we regulate the blood pressure and where the blood pressure or which center that regulate the blood pressure. The blood pressure it is regulated by vasomotor center, which is called the VMC, and it is present in the medulla oblongata. In the arterial region, you will find the chemoreceptors and baroreceptors. They are present in the artery and these are the sensory neurons. As the chemoreceptor, its name indicates that it detects any change in the chemical composition, especially the change in the oxygen and carbon dioxide concentration. Baroreceptor, baro means the pressure. If there is any change in the pressure in the blood vessel, then that will be detected by the baroreceptor, and both these receptors they give the impulse to the vasomotor center, which is present in the medulla oblongata, and it will then regulate the blood pressure by sympathetic and parasympathetic nerves. We will see in details about it. First, we will see the chemoreceptors and how it regulates the blood pressure. Chemoreceptors are the sensory neurons and they alert the cardiovascular center when there is drop in oxygen concentration and rise in carbon dioxide concentration. Now, where the chemoreceptors are located? Chemoreceptors are found in the carotid bodies and aortic bodies, which is located near the carotid sinus and aortic arch. Okay, we will see. See over here, carotid body. This one is the aorta. This one is the aorta, which is branched. Okay, and here there is the presence of the carotid bodies, chemoreceptors. Carotid body, chemoreceptors. So here, this one is the carotid body, chemoreceptors are present. If there is a drop in the oxygen concentration and rise in carbon dioxide concentration, mostly in the hypoxia condition, the chemoreceptor, it will get stimulated. When it will get the stimulated, then it will send the impulse to the cardiovascular center or the cardioregulatory center, which is present in the medulla oblongata through the nerve fibers, actually that by the glossopharyngeal nerve fibers and the vagus nerve fibers. Okay, then when it reaches the cardiovascular center, then it will send the impulse through the sympathetic nervous system to the heart. As it is passed through the sympathetic nervous system, what it will cause? Sympathetic nervous system, it will increase the heart rate and increase the blood flow, also the blood pressure by vasoconstriction. Okay, sympathetic nervous system, it causes the vasoconstriction. It causes the vasoconstriction, thereby it increase the blood pressure and also the blood flow. Okay. On the other hand, if there is the oxygen concentration is more and carbon dioxide concentration is low, then at that time it will give the impulse to the parasympathetic nervous system, and parasympathetic nervous system, it will cause the vasodilation. Yes, it will cause the vasodilation, then the blood flow, it will be reduced. Like this wise, chemoreceptor, it regulates the blood pressure. Now we will see how the baroreceptor, it regulates the blood pressure. Baroreceptor, as I told you before, baro means the pressure. So if there is increase in the blood pressure, increase or decrease in the pressure inside the blood vessel, then this receptor, it will get stimulated. And the baroreceptor, it is located in the carotid sinus. See, baroreceptor, it is present in the aorta and also it is present in the internal wall of carotid artery. Okay, so baroreceptor and the chemoreceptor, they are present in the same location but at the different site. Okay, they are not overlapping with each other. So when the baroreceptor will be stimulated, when the pressure in the blood vessel, it changes. Okay, let's consider if the pressure is more than the normal. So at that time, the baroreceptor, it will send the impulse at faster rate. Let's say in the normal condition, it sends the impulse 10 per beat. But if the pressure, it is more than the normal, then it will send the impulse at the 20 times per the beat. Okay, so it will send the impulse at higher rate, and thus to the cardiovascular regulatory center, which is present in the medulla oblongata. Then it will sense that now the pressure, it is more than the normal condition. Then what will it do? It will, as the pressure it is increases, now it has to decrease the pressure. So which nerve it will be get activated? Of course, it will activate the parasympathetic nervous system and inhibit the sympathetic nervous system when the blood pressure or the pressure is higher at that time. So the parasympathetic nervous system, when it get activated, then it will cause the reduction in the blood pressure, reduction in contractility, reduce the heart rate. Okay, this is how it maintains or keep the normal blood pressure. On the other hand, let's say if the pressure in the blood vessel, it is less than the normal, then this baroreceptor, they will detect that and it will send the impulse to the cardiovascular center. But now the impulse rate, it will move very slowly, like 5 times per beat. Okay, then it will be detected by the cardiovascular center which is present in the medulla oblongata. Now the case is blood pressure or the pressure it is low. If the pressure is low, then to keep the normal you have to increase the pressure. So which nerve it will increase the pressure? Of course it will increase by the sympathetic nervous system. In this condition the sympathetic nervous system it will get activated and parasympathetic nervous system it will inactivated. So sympathetic nervous system it cause the vasoconstriction and increase the blood pressure, also contractility and the heart rate. Okay, this is how the baroreceptor it works to keep the blood pressure in normal level. Okay, effect of blood pressure, it is this flowchart it represents when the blood pressure level is high. Okay, baroreceptor it will enter into the medulla, then the secondary signal it inhibit the vasoconstrictor center. So vasoconstrictor center of the medulla and it will excite the parasympathetic nervous system. So as the parasympathetic nervous system it get excited, then it will cause the vasodilation and it decrease the heart rate and the contraction also. So therefore excitation of baroreceptor by high pressure. Okay, this is the flowchart that represent when the pressure is high. So the excitation of baroreceptor by high pressure in the artery reflexly cause arterial pressure to decrease. Okay, but if in the other hand if the pressure is low, then it will excite the sympathetic nervous system and it will inhibit the vasodilator center, that is the parasympathetic nervous system. Another one that regulate the blood pressure is renin-angiotensin aldosterone system, RAAS system. This center it will get activated when the blood pressure it is low. Then blood it flows to the kidney, juxtaglomerular apparatus of kidney it will secrete a hormone. That hormone is known as renin, and this renin hormone it will convert the angiotensinogen into angiotensin 1. Then further angiotensin 1 it will converted into angiotensin 2 by angiotensin converting enzyme. Okay, this angiotensin 2, this one is the vasoconstrictor. It will cause the vasoconstriction of arterioles. So is the constriction or the vasoconstriction of the arteriole, the arteriole is now constricted. So is the arteriole it get constricted, then it will increase the blood pressure. Okay, on the other hand angiotensin 2 it activate the adrenal cortex. Adrenal cortex it secrete the hormone that is known as the aldosterone. Aldosterone it will retain the salt and water in the kidney, thereby it increase the blood volume. So this is how the RAAS system works when the blood pressure is low, to keep the blood pressure to the normal level. Besides that, the another factor that also regulate the blood pressure is known as ANP, that is arterial natriuretic peptide. Arterial natriuretic peptide, this hormone it secretes when there is more venous return, that will cause the vasodilation and it increase the excretion of water and the salt, thereby it decrease the blood pressure. Okay, arterial natriuretic peptide hormone it decrease the blood pressure. So now we'll see some of the previous year CSIR net question. In this diagram, name the chemicals A, B, C, D in proper sequence. Decreased arterial pressure. Arterial pressure or the blood pressure it get decreased. Then the from kidney, which hormone it will secrete? It will be the renin. So renin it is present in A, C, D. So let's eliminate option B. Then the hormone the renin, then it will convert what? Angiotensinogen, right? So it's angiotensin. So these two are wrong and this one is the correct answer. So it will renin secrete, then renin it will convert the angiotensinogen to angiotensin 1, then angiotensin converting enzyme, this converting enzyme from the lung, it will convert the angiotensin 1 into angiotensin 2. Okay, then that will cause the vasoconstriction, and on the other hand it will secrete the aldosterone from the adrenal cortex, which will retain the salt and water, thereby it will increase the blood pressure or the arterial pressure. So what will be the correct answer? Correct answer is option D. Okay, let's see the next one. Which one of the following does not occur due to stimulation of baroreceptor? Okay. Bradycardia, hypotension, venodilation and vasoconstriction. Which one will not occur? That is the option D is the vasoconstriction. Thank you so much for watching this video. Hope this video will definitely help you a lot. If you still have any confusion regarding blood pressure and its regulation, then please put a comment in the comment box down below. I will get back to you as soon as possible. Please do share this video with your friends and subscribe my channel. Stay connected for more informative videos. Bye bye. See you in my next video.